Hi everyone, I'm Beverly. This is Stacy. We are two of the International Board Certified Lactation Consultants here at Sky Ridge Medical Center. We are doing a video today to answer your top 10 frequently asked questions about breastfeeding. And the reason we're doing this is because of the coronavirus pandemic. We are postponing our outpatient breastfeeding support groups, and we know this information is very important to you. We care about you all. We wish we could be in person with you right now, but since we can't, we thought this would be a great way just to get some good basic breastfeeding information out to you. So I'm going to start with the first question, and then I'll hand it over to Stacy. We each have a list of questions. The first one is, how do you handle primary engorgement? Primary engorgement is when around days 2 to 5, that big milk supply, what we call the transitional milk, just comes rushing in. It's excess milk, it's excess fluid. Your breasts are going to be very full and tight for 24 to 48 hours. It can be a little disconcerting. You don't recognize your body sometimes, but I promise you it's temporary. It will get better. So how do you handle this? There is the use of heat and massage, and then there is the use of ice or cold packs. Generally speaking, during primary engorgement, you want to use cold packs on your breast between breastfeedings. So 15 minutes on, 15 minutes off. A lot of moms like to use bags of frozen peas or corn. I know that sounds funny, but they're big, they're moldable. Put a thin, cold, wet washcloth over the bag and then put that on your breast to help reduce swelling. The use of heat and massage, you want to be careful with that because too much heat can actually increase swelling. So if you wanted to do just 2 to 3 minutes of a warm, wet washcloth to the breast, or maybe standing in a warm shower for a few minutes before you breastfeed, taking the pads of 2 to 3 fingers, doing some vigorous circular massage around the breast. The heat plus the massage for, again, just 2 to 3 minutes before you breastfeed can help the milk flow a little better. Some women have to play around with the heat and massage versus the cold packs to see what works best for you. Okay, Stacy, what's your question?
Okay, so second question is how to handle sore nipples, and is this normal? Yes, lots of women get tender nipples when they breastfeed, and this is very common. When you should be concerned is when the nipple is bleeding, when there's abrasions, when the pain is so much that you don't want to continue breastfeeding. So some things you can do. Make sure that you're keeping your nipples supple and moist, because when your nipple is moist and soft, it stretches easily. So in between feedings, if you let your nipple dry out, then the baby gets on there and pulls, it's going to cause tiny little tears that you can't even see on the edge of your nipple, and that's very painful. But if we can keep your nipple soft and supple, then when the baby pulls, it's going to still be tender, but it's not going to cause those tears. So you can get that with using the lanolin lotion. We gave you some in the hospital, but if you need to go to the store and buy some, do that. And there's something called gel pads. They're hydrogel pads. They are wonderful. They really help your nipple feel so much better. So what you do is between breastfeeding, you use these gel pads, and what they're doing is they're trapping in the moisture, and they're going to help that nipple to stay supple and moist. So those are the things. If your nipples are bleeding, if you're having trouble, you need to make sure that you're calling somebody. Call us here at our department, and we'll talk to you about what else we can do.
Okay, great. Next question, frequency and duration of breastfeeding. So how often should you be breastfeeding your baby? First of all, around days 2 and 3, a lot of breastfeeding babies will do something called cluster feeding. So don't worry if your baby's nursing, every hour for several feedings in a row, or babies having clusters here and there in days 2 or 3, night or day, where they have a great feeding and you think, oh good, I'm gonna get to sleep for a couple of hours, and then 20 minutes later they're munching on their little hands, acting like they're starving. Normal breastfeeding behavior for days 2 and 3 until your big milk supply, what we call your transitional milk, comes in. Once your transitional milk is in, you're feeling very full, you want your baby breastfeeding 8 or more times in every 24-hour period. The general guideline is wake your baby by the 3-hour mark during the day. We do time breastfeedings from the beginning of one feeding to the beginning of the next. And at night in the first month, baby's probably going to be nursing every 2 to 3 hours around the clock, but at night, if they'll give you 1 4-hour stretch that first month, absolutely take it. As far as how long to breastfeed, babies will do different lengths at different feedings and different numbers of minutes on each breast at a feeding. So you don't have to, get caught up into thinking you have to make it be 10 and 10 or 15 and 15. It's not strict like that. So that's actually kind of liberating. You're going to watch baby more than the clock, we say. So as long as baby is picking up with those good, strong sucking bursts on the first side, let them keep going. Always offer the other breast, but at any given feeding, baby may or may not want to take the second side. If they don't want the second side, no big deal. Start on that side at the next feeding. Whatever side baby ends up on is the one you want to start on at the next feeding. All right, Stace.
Okay, so the next question is if baby refuses to feed. So, babies need to eat at least 8 times in a 24-hour period. And so sometimes we have it where a baby, it's due to feed, but it won't feed. And then people really worry about that. So I want you to be more concerned with how many feedings they're getting in a total day. But if you feel like your baby really does need to eat and you're wondering what can I do, make the baby naked, change that diaper, get the baby down to just a diaper and naked. Do some nice skin to skin, put the baby on your chest, try to wake the baby up. Pediatricians will tell you that if the baby's refusing more than 1 feed in a row, that you need to call them. So we don't want your baby to become dehydrated, but it's normal that they don't always feed when you want them to feed. But again, you want to make sure those 8 feedings are in there and that you're just doing nice skin to skin to encourage the baby to wake up and feed.
Okay, great. So the next question is, how do I know when to switch sides? So there are these 2 terms, and it's great to know the difference between these: nutritive sucking and non-nutritive sucking. And when you learn to tell the difference between these 2 things that babies are doing at the breast, it's so empowering to know when to switch sides. So nutritive sucking is when baby is latched on, they're dropping into that nice, deep, rhythmic suction pattern. You can hear swallows. They're taking in milk. This is nutritive sucking. Let them keep going. Eventually, during the feeding on that first side, they will transition to what we call non-nutritive sucking, where they're really just kind of hanging around, just hanging out, kind of doing little wimpy, what I call flutter sucks. So if baby does not do that classic pop off to show you they're finished on the first side, they're still latched on, but you're stimulating them, with a little push up under the chin or a little rub to the head, and they're not giving you those really deep rhythmic sucks anymore. They're just kind of doing the little flutter sucks. They have transitioned to non-nutritive sucking. They are not transferring milk anymore. So you want to learn to recognize when they've gotten to the non-nutritive sucking, and if they don't come off themselves, that's when you take your finger, little finger's just fine, do kind of a fish hook down in the corner of baby's mouth to break the suction. Don't be afraid to really get down in between baby's gums and your nipple to break the suction. We don't want to take baby, directly off without breaking the suction. That can make you very sore. And then go ahead and, take a couple of minutes to try to burp baby and then offer the other side. And then same thing, look for that nutritive versus non-nutritive sucking on the second side to know when the feeding is over completely. All right.
Okay, so a proper positioning and latching. So this is very tricky, especially with your first baby. So what I want you to think of is you really want your baby's mouth open very wide and grabbing not just the nipple, but up on the areola. So it's really important that you don't just offer your nipple right in the front of your baby's mouth, because what they're going to do is usually not open super wide and just grab your nipple. So it's super important to do what's called an asymmetrical latch. So this is a term, you can look it up online. There's lots of videos for this latch technique. So what you're going to do is line your baby up nipple to nose. So you're going to start with that nipple up a little high. Sorry, this is your baby's mouth and this is your nipple. So what you're going to want to do is line your baby nipple to nose and then bring the head of the baby back so the chin is touching down here. So ideally you're going to tickle your baby between the nose and the upper lip, and you want that chin to touch down low, and then for the baby to reach up and over to get on that deeper latch. And so that will ensure that your baby is off of your nipple and onto your areola. So again, Google that. That is definitely the best latch technique there is out there. So again, you can call us and talk to us about making that happen.
Okay, great. This next question is probably one of the most popular questions we get, which is, how do I know my baby's getting enough milk? That is a great question, and thankfully we do have tangible ways to know your baby's getting enough milk. It's not just a guessing game. So one of the main things, and I already touched on this a little bit, is hearing swallows. So in the first few days of baby's life, you may not hear the swallows, or you may hear them, they're very subtle. It might be 6, 8, 10 sucks before baby collects enough milk in the back of their throat to trigger a swallow. But once that big milk supply is in, the transitional milk, you will literally hear your baby gulping. And that's so encouraging to hear those gulps or swallows. So hearing swallows is one way to tell your baby's getting the milk. Diaper count is huge. So, from the minute your baby's born, we're tracking those pees and poops, or stools as we call them. You're telling your nurse whenever your baby pees or poops. When you go home, I think it's a great idea, at least this first month, to keep a diaper log. You can use old-fashioned pen and paper, or they're great apps. I know Baby Tracker's one. Is there Eat, Sleep, Poop, I think, is one. So great apps to track the diapers. But basically, from day 4 of life on, you want to see at least 6 very wet diapers in every 24-hour period, and at least 3 stools in every 24-hour period. When I say very wet diapers, I just mean if you were to have a wet diaper in one hand and a dry one in the other, you want to feel a little weight to the wet diaper. So again, day 4 on, at least 6 wets and 3 stools in every 24-hour period. Now, if baby has more than that, fantastic. The 6 and 3 would be the minimum diaper count we would want to see to know your baby's getting enough milk from you. When babies hit around 4 to 6 weeks of age, though, they may start pooping less, so don't let that worry you. You may have a baby who is pooping several times a day, all of a sudden, just having 1 stool a day, 1 every other day, or maybe even 1 every few days. Totally normal. You still want to see the 6 or more wets, though. And then finally, weight gain. Most breastfeeding babies lose up to about 7% of their birth weight in the first few days, normal and expected. After the first week, they typically start gaining. The first big weight gain goal we want to see is gaining birth weight back by 2 weeks of age. And you'll be able to go to your pediatrician and make sure they've met that weight goal for 2 weeks. After that, we want to see about 1/2 to 1 ounce weight gain per day. So if you have any concern about your baby gaining weight appropriately, give your pediatrician a call, ask if you can pop in and have them weigh baby quickly.
Okay, so the next question is about nipple shields. So nipple shields are a lovely device. They're made out of silicone and they just fit over the top of your breast and your nipple. We use nipple shields for many different reasons. If your nipple's a little shorter, we might have given you one in the hospital to use. Say the baby's premature and just is having a hard time at the breast, we might have given you a nipple shield in the hospital. But sometimes nipple shields need to be started at home, and the biggest reason for that is going to be if your baby's not feeding adequately, if you're noticing your baby's getting on the breast but then coming off of the breast and not sustaining that latch, it's not a bad idea to pick up a nipple shield. They cost about $6.50, so you can buy them on Amazon or in your local store. I like to think of it as kind of, it's like your helper. It's protecting you. It's helping the baby get good feedings. Some women use nipple shields because their nipples are very sore. They go through a time when their nipple gets very tender and they're reluctant to breastfeed. And so a lot of times we'll introduce a shield, and it's kind of like a little barrier between you and your baby's mouth, and it helps the baby get on a little bit deeper, and it takes some pressure off of the nipple. I think they're wonderful. A lot of people are worried about using nipple shields because they've heard, oh gosh, don't start using a shield, you'll never get off of it. But that's not usually true, and it can really be a blessing to use a shield during a time when you're really sore and you really want to breastfeed desperately, but you're just kind of nervous to continue on. Usually coming off of a shield isn't that hard. Usually what we're going to have you do is start with the shield, have the baby get into a nice suck pattern on the shield and kind of hunker into the feeding. About 3 to 5 minutes into the feeding, go ahead and take your baby off, remove the shield, and see if your baby will just get onto the nipple without the shield. And usually this is very successful. It can take about a week sometimes to get the baby to do that, but most women can come off of it. But please do not hesitate to use a shield if you need to. Now, one thing with the shield, if you're using a shield before your milk comes in, then you definitely need to make sure that you're pumping. So before your milk comes in through stimulation, and that little bit of a shield takes away some of the stimulation on your breast and can keep your milk from coming in fully. So if you're using a shield before your milk comes in, please do about 5 pumping sessions after feedings a day just to do a little extra stimulation. But once your milk comes in, it's no longer about stimulation, it's about removing the milk from your breast, and using a shield proves that you remove the same amount of milk whether you're using it or not. And so once your milk is in, you can use the shield as you want to, and you usually don't have to do any extra pumping.
Okay, great. And then my final question is on a subject that you don't hear a whole lot of people talk about, but it's very important to know about, and it's growth spurts. Babies will typically have growth spurts around 3 and 6 weeks of age, and then again around 3 and 6 months of age. So you will have a baby who's in this beautiful, predictable breastfeeding pattern. They're nursing every 2 to 3 hours around the clock. You're thinking, okay, I finally got this down. And then all of a sudden that first growth spurt hits. And then all of a sudden baby's nursing every hour for several feedings in a row. It's very similar to that cluster feeding we talked about that they do in days 2 and 3 of life. So if your baby does start nursing more frequently and nothing else has changed, just think, where are we time-wise? Are we around 3 weeks of age, around 6 weeks of age? Could this be a growth spurt? Just go with it. Whenever baby is smacking or munching on their little hand, or maybe they've been asleep for 45 minutes or an hour and they're starting to kind of rustle around and look like they're looking around for the breast, rooting we call it, go ahead and latch them back on. The growth spurts, baby's going to nurse more frequently for a couple of days. They're trying to boost your milk supply for their growing needs. Normal, natural. It can be frustrating. It can make you worry that your milk supply is decreased, but that's not the case. So just keep putting baby back to breast whenever they're acting hungry. That'll boost your milk supply for their growing needs. And then after a couple of days, they should go back to their previous breastfeeding pattern.
Okay, and my final question is about pumping. People always want to know, when should we start pumping? Do I need to pump right away, or do I need to, can I wait? So ideally, if you're on a special feeding plan, you're going to be pumping, and we will have gone over with you in the hospital. Other reasons to pump are going to be, say you're going back to work and you want to start building up a supply, in your refrigerator or your freezer. The American Academy of Pediatrics, doesn't really recommend bottles or pacifiers for the first month of life. And so it takes 2 weeks for your milk supply to come in fully. So I wouldn't recommend pumping, until about 2 to 4 weeks after the baby is born. And then most women are successful just doing that first pumping of the day. So you're gonna wake up in the morning, you're gonna have probably more milk than your baby needs. So go ahead and feed your baby and then pump off the rest. And you can take that milk and put it in your fridge. Usually you want to be freezing your milk in about 3 ounce to 4 ounce amounts. And so if you pump out 2 ounces one day, leave that in the refrigerator, and then the next morning you're going to pump out, say, 2 ounces, and then let them both get cold, and then you can combine the cold milk together to make about a 4-ounce bag. And that's what you want to put in the freezer. Lay it flat in the freezer; it'll freeze flat. Make sure you date it with what date you froze it, and then it's good for about 6 to 9 months in your refrigerator freezer. If you have any other questions about pumping or anything that we've talked about, please give us a call. 720-225-2233 is our lactation number. We are here every single day of the year, and we're happy to call you back with an answer.
Yes.